All right, welcome back to Chronicles. I'm Eric Marquette here with Ruby Sturt. Today we're diving into how the Covid-19 pandemic really shone a massive spotlight on the cracks in our global health systems.
Yeah, and not just little cracks, right? Like full-on chasms. I mean, you remember those early days, Italy's hospitals just absolutely overwhelmed, and then India too, with people literally queuing outside for beds and oxygen. It was heartbreaking.
Absolutely. And, I remember producing this radio segment back in early 2020 about UK hospitals bracing for a surge. At the time, I thought, all right, this will be a rough winter. But I never imagined it would become this global, systemic thing. It was like watching dominoes fall one after another.
Yeah, and it wasn't just the big headline-grabbing places. Even in Australia, we saw supply shortages, staff burnout, all of it. But it was especially tough in lower-income regions where the infrastructure just wasn't there to begin with. But then, almost overnight, everything went digital. Like my GP appointment suddenly happened on my phone. I felt like I was in a sci-fi movie, honestly. Did you have that, Eric?
Yeah, I did. And it was wild how quickly telemedicine became the norm. South Korea, for example, really leaned into digital contact tracing. They managed outbreaks with these apps that tracked exposure. Privacy debates aside, it was effective.
It's funny because before COVID, I'd never even considered a video call with my doctor. Now it's just like standard. It's one of those things that probably would have taken years to catch on otherwise.
And all this really highlighted how much we need global cooperation. I mean, the disparities in vaccine access alone. Some countries had more doses than people. Others were left waiting months. It was a bit of a mess, wasn't it?
Totally. And it's not just about vaccines, right? It's about data, resources, even just sharing information quickly. If we want to build more resilient, fair health systems, countries have to work together. No one's safe until everyone's safe, as they say.
Yeah, and I think the big question is, what steps do we actually take? Because as we saw, good intentions aren't enough when the pressure's on.
Well, for starters, international health regulations need some teeth, like actual mandatory compliance, regular audits. Otherwise, it's just guidelines on paper.
And a global health data sharing platform would be huge. Something secure, anonymised, so countries can exchange real-time info without worrying about privacy breaches or, political fallout.
Plus, investing in infrastructure and training in lower-income countries. If we don't close those gaps, we're just setting ourselves up for the same problems next time.
Exactly. And maybe we need international funding mechanisms that can deploy resources and people fast, not after months of debate, like a rapid response fund that's ready to go.
And global training programs too. Imagine using virtual reality to prep healthcare workers for crisis scenarios, so everyone's on the same page, no matter where they are.
Yeah, and cross-border research. If we can develop vaccines and treatments that are accessible everywhere, we're not as dependent on a handful of manufacturers. That's a big deal.
But it's not just about the big global stuff. Local communities need to be involved too. Grassroots education, engagement, so people know what to do when things go sideways.
And partnerships, governments, NGOs, private sector, all working together on local health initiatives. It's like supplementing the national response with boots on the ground.
Yeah, and having rapid response teams within communities, people who are trained to act fast, contain outbreaks before they get out of hand. It's that early action that can make all the difference.
Speaking of early action, AI-powered predictive analytics could be a game changer. If we can spot outbreaks before they escalate, we can actually do something about it, instead of just reacting.
And communication matters too. We need public health platforms that are multilingual, culturally sensitive, so everyone gets the message, not just the people who already know what's going on.
Plus international standards for data sharing and cybersecurity. If we're going to swap health info across borders, it's got to be safe and efficient. Otherwise, people just won't trust it.
I love the idea of cross-border simulation exercises, like actually running drills with multiple countries and agencies, not just talking about it, test the plans, find the holes, fix them.
And a global repository of best practices, somewhere everyone can access lessons learned from recent crises. It's about continuous learning, not reinventing the wheel every time.
And maybe a dedicated international task force using advanced surveillance tech to monitor threats and coordinate responses. It's a lot, but it's doable if there's the will.
Looking ahead, we've got to think about workforce diversity too. training underrepresented groups, making sure care is culturally competent. That's how you build trust and equity.
And, okay, this might sound a bit techie, but blockchain for health records? It could make data exchanges more transparent and tamper-proof. I mean, I'm not a blockchain expert, but it sounds promising.
No, I think you're right. And we can't ignore environmental health either. Climate change is shifting disease patterns, so integrating environmental policies with health emergency plans just makes sense.
So where do we go from here? Maybe a global health innovation fund, supporting startups and research focused on pandemic preparedness. Get those fresh ideas out there.
And mandatory simulation drills for all nations. At least every couple of years, it's like a fire drill. But for pandemics, you find the gaps before it's too late.
And a global health workforce exchange program. Let healthcare pros work across borders, share knowledge, build capacity, and honestly, just learn from each other. That's how you get real resilience.
Absolutely. Well, that's all we've got for today's episode of Chronicles. The pandemic exposed a lot, but it also showed us what's possible when we innovate and work together.
Yeah, and there's heaps more to explore. Thanks for listening, everyone. Eric, always a pleasure.
Likewise, Ruby. Take care and we'll catch you next time on Chronicles.
See ya, everyone.